these years and for your continued commitment to biomedical research and especially to this very important issue of autism. I just had dinner Sunday night with a couple whose child is autistic, and all I can tell you is that we've got to do something about this. It's out of control, and people are looking to us for some answers and some help. And hopefully this hearing today will begin to hopefully point us in the right direction on which we should go. So we'll kick it off first with Dr. Julie Gerberding, the Director of the Centers for Disease Control and Prevention. Dr. Gerberding, welcome back.
Thank you. It's good to be back. We really appreciate the committee's interest in this topic. Is my microphone on? Can you hear me okay?
Yes.
We are very grateful for all the support that the committee has given us, and particularly for our ability to expand our autism activities significantly. And, Senator Harkin, I also know that you walk your talk on this issue, having had a chance to be with you at the Summer Olympics, the Special Olympics last summer, and knowing your commitment to developmental disabilities and disabilities of all nature. So we really appreciate your championing this issue. I'd like to share with you the CDC perspective on autism and the work that we're doing. It's important to appreciate that we recognize that we're talking about a spectrum of diseases here, not a single disease. We're talking about autism per se, about pervasive developmental disorders and some other conditions that have characteristics in common with autism, Asperger's disorder, and some other conditions. And these are diseases that are not diagnosed by a test. They're diseases that are diagnosed by observing behaviors and watching behaviors change and develop over time. So there's a lot of difficulty in making a distinction between who has what and where one of these conditions leaves off and the other one begins. We know that autism has a tremendous impact on children who are affected, as well as their families and the people who care for them. The diseases are characterized primarily by difficulties in forming relationships and engaging in the kind of social interactions and communications that enrich life and allow people to effectively communicate with one another. Many of these children also have differences in the way they respond to stimuli in the environment, the way they learn, the way they play, and the way they experience their life overall. The bottom line is there is no cure for autism now, and these effects can last a lifetime. We also know that the sooner we make the diagnosis of autism spectrum disorders, the more likely children are to benefit from interventions. And so it's imperative that we not wait until the full-blown syndrome has evolved, but that we have early detection and characterization. Under the Combating Autism Act, CDC has three main responsibilities. One is to answer your first question. What is the prevalence of autism in our communities, and is it changing over time, and who's at risk, why, and when? Our second priority is research. We are engaged in several kinds of epidemiologic research that will help us look at a variety of the hypotheses about causality and try to make some determinations about which are the most promising associations and what can we learn about cause that could help us lead to intervention or even treatment. Lastly and importantly is our responsibility for awareness. We need to be able to inform parents and caregivers, as well as teachers and clinicians, about the full spectrum of these conditions so that earlier diagnosis is possible. We also need to improve community awareness so that children can live more comfortably in their communities, and overall public awareness so that we have the kind of support we need to solve these problems. Just recently, CDC published information about the rate of autism in communities around our country. And I'm going to focus on the communities that were reporting data in 2002. We also have a report from 2000, and there will be an upcoming report on information from 2004. But the information from 2002 probably is the largest sample, and so I'm going to focus on that. This represents about 10% of 8-year-old children in our country, so it's not everyone, it's not every community, but it's a significant proportion. What was found in this study is that about 1 in 150 children have autism, boys in general were more likely than girls, and at least some of the sites showed that white children were more likely to have autism than non-white children. So this was a healthy, a helpful perspective, but we can't yet say anything about trends over time until these studies go on for a longer period of time. We also have initiated a set of studies in a group of sites called CADRE, Centers for Autism and Development Disabilities Research and Epidemiology. And this is a study that will allow us to look at causes. We're going to compare children who have these disorders with children who have other disabilities and children who are normal, and look for the frequency of a variety of factors, including infections, as you mentioned in the Discovery magazine, their parents' health status, their family health status, their genes, and so on and so forth. We will be able to tease out of that leading hypotheses about why are children with autism different from children who have other conditions or who don't have a developmental disability. And this is a project we're starting this spring, and we will probably have information from this study over the next couple of years. The last point I wanted to make very quickly was the importance of awareness. We know that at least half of children with autism have obvious symptoms and signs before they're age 3. But most children with autism are not diagnosed until they're 4 or 5 years old. So there's a gap between when it should be completely clear what is going on and the gap when they come to attention. So we initiated this Learn the Signs, Act Early campaign to target parents, health professionals, and caregivers in preschool and daycare to be able to recognize the child who is at risk or who may have early signs. And of course, we're doing this with a number of our partners. This has been an incredibly effective campaign already. Pediatricians now indicate that they have the tools to be able to diagnose autism at least 2/3 of the time. Parents understand that this disease can be detected through developmental screening, and an increasing proportion of doctors recognize that you can diagnose autism as early as 18 months and that you need to initiate the screening much earlier than when the child enters school, which is often when these conditions are initially detected. So we're going to continue this awareness campaign. We hope that will create a platform so that the work that we're doing on research on causality and interventions will have a better chance to really make a difference. So again, thank you for your attention, and I look forward to being able to answer some specific questions that you mentioned at the beginning of this hearing.
Thank you, Dr. Gerberding. And I just would mention I am going to change the format since Senator Spector has to leave. I will go with Dr. Insall, and we will have some questions for the two of you before we